We're live, Chairman.
Good morning, everybody, and welcome to this morning's meeting of the Public Health and Community Safety Cabinet Panel on Monday, the 28th of March. This meeting is being held electronically. Members of the public may also attend the meeting in electronic capacity, and there is a link on the Council's website for them to do so. Members of this meeting are asked to keep their microphones switched off until you're called to speak, and then to switch your microphones off once you've finished speaking. Cameras may be left on throughout the meeting, so it doesn't get too lonely for the chairman. If members wish to, cameras should be switched on if and when you're going to speak in the meeting. To indicate you wish to speak, please raise the hand function. Use of the meeting chat function should be used exclusively for voting, and at the end of each debate item of business, there will be a vote, and members will be asked to vote using for, abstain or against, and I will declare the result after each one. Now, membership changes for this morning's meeting. I have none. Apologies, I have none to date. So the next item is member interests. Do members have any members of any interest they would like to declare in connection with any items on this morning's agenda? I'm receiving no indicate. Judy Billing?
Sorry, I was going to do it before the item. I declare a personal interest on the item on clinically extremely vulnerable. Okay,
is that just a non-pecuniary interest? Just
yeah.
Okay, fine, thank you. All right, any other announcements? Sorry, any other declarations? There are none. So chairman's announcements, none other than the ones I've just given. I always think on these occasions that if there are people watching, it's nice for us to introduce ourselves. So if I just call out your name, you can then tell us who you are on which area you represent. So David Barnard.
We're still waiting on him to arrive, Chairman.
Judy Billing.
Hello, I'm Judy Billing and I represent Hitchin North.
Sarah Bedford.
Sarah Bedford and I represent Abbots Langley.
John Hale.
John Hale representing Coney Heath and Mileswick.
John Hale. Ronnie Hearn. I don't think she's well. Fiona Hill.
Fiona Hill, and I represent Royston East and Ermine.
Fiona Thompson.
Good morning, Fiona Thompson. I represent Hanside and Peartree.
And Fiona is also vice chair of this panel. Sunny Thusu.
Hello, good morning. I represent Haldens and Welwyn Garden City.
Ron Tyndall.
Hi, I'm Ron Tyndall. I represent Hemel Hempstead St Paul's.
And just checking the final one. Colette Wyatt-Lowe.
Good morning, everybody. I'm Colette Wyatt-Lowe, and I represent Hemel Hempstead North East, or Groveville and Woodall Farm, as we all know it. Thank you.
Thank you, everybody. Let's have a great panel meeting. So item 1 on the agenda is minutes. I'd like to invite the panel to agree the minutes of the Public Health and Community Safety Cabinet panel that was held on the 1st of February. If you could just put agree into chat if you're happy. Only got 2 in there so far. Oh, they're coming through now. Any more? Yes, a few more, please, if there are any. 5. I think that takes us over, doesn't it, Carly? Yeah, that takes us over. Any more for any more? In which case, Carly, is that enough for us?
That one's agreed, Maurice.
Lovely, thank you very much indeed. So we now move over to item 2, which is, I'm working paperless. I just want everyone to know, in case you wonder why I'm pausing slightly, I've moved paperless. I haven't got a printer in the house now. I've got some quill and parchment, but no printer. Okay, item 2, petitions. There are no petitions at today's meeting. So we're now going to move over to item 3, which is an update report from David Lloyd, the Police and Crime Commissioner for Hertfordshire. I'm delighted that David is here this morning. Look forward to hearing everything from you now. And it's over to you, David.
Thanks very much, Maurice. And as always, it's good to be with you and good to be able to talk through just one item today, which is the end of the process in terms of publishing the police and crime plan, which will be published by the statutory deadline, which is 31st of March. I recognise that I think you've had 59 pages of it in front of you. I recognise it's a long plan, and it may well be that people won't have had the chance of reading it all. So I'll give what I see as the, if you like, the how I've got here and what's influenced it, and I'm very happy, of course, to take any questions on it or any other item later on. It's been through the police and crime panel where it was approved, so really this is a courtesy bringing it here. The history of the police and crime plan, and I've had a number of these since 2012. Really what drives this plan is 4 or 5 things. First of all, of course, the manifesto promises which I or any other elected politician will have made. I feel they in many ways form a sort of contract, so you'd expect to see those within the plan, and indeed they are, and I'll come back to that as the priorities within the plan. So that's an important part of it. Clearly, the history of the constabulary and the criminal justice system are also important in terms of writing a community safety and criminal justice plan. So the Hertfordshire, as we're all aware, is an area of low crime, very low crime given its location in many ways, and is one of the best performing forces, so that the plan is bound to reflect that. It also reflects and will need to be updated, I imagine, within the next few months, because central government, Home Office, is what it calls leaning in. It has a strategic policing requirement, which will have for the first time domestic abuse in it, not something which is new to my plans, but clearly we will need to make sure that we reflect exactly what the Home Office wants to do and what it wants to do in its beating crime plan. So that's important too. But the 2 things which are perhaps new to me, others might not be new to it, but which are new to me, are first of all the approach which I've had through some of the academic work I've been doing around evidence-based policing, which is an approach which I think makes sense in terms of how policing should happen, looking at the evidence before one makes some decisions. I think it's really useful for all politicians to do, and it's been the subject of work I've been doing with Cambridge University. And of course, that also has led into what's been called a prevention first approach, and you know, realizing, as I'm sure we all do around the virtual table here, that people would prefer not to be victims of crime in the first place, and that actually preventing a crime, which goes right back to those Pelian principles, that preventing a crime is far better than waiting for a crime to occur, no matter how good the follow-up is post-crime. And the other area which has really been important on this has been the public opinion survey, which I'll come back to, which I undertook across a demographically and geographically appropriate poll of people across Hertfordshire. The themes which come out within the plan, and which you will have seen, are themes of criminal justice, fairness, equality and confidence in policing, and representing the public. I think that and digital and commerciality. I think that it's true to say that at the moment nationally, if not locally, nationally, the whole issue of legitimacy and policing is one of the things which has happened and which we need to tackle everywhere. We need to have confidence in our police if we're going to be able to ensure that the public feel well policed, and that is really urgent for us to look at and to make sure that people understand what a good police force we have. But our priorities are the same priorities actually that they have been for the last 10 years, which are to keep crime low, to keep a focus on victims, to continue to recruit more officers, to protect local policing, to increase efficiency, and to keep the tax burden low. And I think that this means that we're going to have to continue to work well and perhaps even better with health, with criminal justice partners, and with partners in councils, county and district. The learning for me has been that, first of all, how clear it is that public opinion around what we should be focusing on isn't actually exactly the same as what those sort of commentators might talk to us about. So I asked people specifically what made them feel unsafe, and what makes them feel unsafe is around dark streets and around parks in public places, especially parks which are dark. And what was their fear of crime, I asked them, and that was around domestic burglary and around cyber fraud and cyber crime. The interesting thing is, of course, that doesn't necessarily reflect the actuality, and I think we've got to recognise that, but that does mean that people need to be better informed, and that's part of all of our roles. So people feel that domestic burglary is something which they're concerned about, but domestic burglary has halved over the last 2 or 3 years. So their fear isn't related to an increase in burglary. It is around the fear which they still have if a burglary takes place. And I think some of the issue around street lighting as well and darkness isn't necessarily about saying that streets are dark at certain times. It is that they feel unsafe if streets are dark, which is subtly different, but I think is far easier it's not easier to put right, but is something which we need to have in mind when we're looking for solutions around it. The other thing which really interested me was, which I hadn't thought through before, everyone else probably had, but actually I always made the assumption that because there are some areas which have no high harm crime, and I'm not going to have a lecture on what high harm crime is, but as a thought, not all crime is equal, and you can rank crime by, if you like, what the prison sentences would be around it. So that would suggest that murder is a higher harm crime than shoplifting, for example. And so if you look to where high harm crime is and do a map of high harm crime, there are parts of the county which have less or no high harm crime in any one year. And because of that, I had assumed, intellectually wrongly, but I had assumed that those areas whose only crime is antisocial behaviour, or whose only issue is antisocial behaviour, might be those which have the highest reporting of antisocial behaviour, but not at all. If you go back to the evidence, what it shows is those areas that have the highest harm crime also see the highest occurrence of antisocial behaviour, for example. So across the county, the lowest, the LSOA, lowest super output area, which broadly is about the same as our wards, the place which is the highest for high harm, Bedwell in Stevenage, is also the highest for, or one of the top 10 for antisocial behaviour. And I think that it's quite interesting to think back through, so that there are parts of the county which have very little crime whatsoever, but they will also have very little antisocial behaviour. And in terms of how we might police those areas, we need to put our resource to those places where the high harm crime is the highest. And given the fact that we now have an uplift programme which gives us significantly more police officers than we've ever had, part of that focus must be in using those police officers locally, but having in mind that there will be areas that they will be able to do even more good than other areas. And we need to focus on those areas, and some of that is around sort of some of the evidence that we've got from originally from Western Australia, but also in Kansas. So international evidence which says if you look to high harm spots, very focused areas, and you put a police patrol of 15 minutes at least every 3 days into that area, that crime drops. Let's get on and make sure that we do that, and that's part of what comes out of this plan. I think that's probably enough of a summary. I could speak for 2 or 3 hours. I think I did almost at Police and Crime Panel, so I'm not going to do that again. But I know people will have questions around it, and I think that summarises where we're at with the plan.
Thank you. This is not our sponsored talkathon, thankfully. So we appreciate the brevity of that introduction. Bearing in mind that I know we have got hands straight up there, but bearing in mind that Judy has to leave in a couple of minutes to chair a meeting for somebody else who's unwell. Judy, did you want to come in with anything at this stage, and then you're politely excused?
No, thank you very much for allowing me the opportunity, but I don't need to.
Thank you very much indeed. You've had a bit of a pass there, David. Make the best of it. So, but I'll come over to Ron Tyndall. He'll make up for it. Ron. Should I tell him he's on mute? Yeah, go on then. Ron, you're on mute.
Sorry, I don't actually think I was the first, but however, yeah, thanks for that. David, you mentioned first principles include preventing a crime. On page 15 at the top of your plan, it's identified a key theme of domestic abuse strategy as education and early identification. I've struggled for some years to promote education in secondary schools on domestic abuse, and I just wondered whether or not what you see as education going forward, perhaps first offenders, perhaps trying to get into the teenage audience that are just learning about relationships and trying to prevent this horrible crime, because otherwise we'll just see it continue to escalate through the generations.
Well, Ron, I think we've both worked for a number of years back to police authority days and prior to that on domestic abuse together, and clearly you're right that education, both in terms of families but also in terms of schools, must be a place that we've got to redouble our efforts. So often domestic abuse is a learned pattern within families where a male partner may well abuse the female partner or other partner, and the children grow up seeing this as an expression of love. It is really very difficult to get in, but actually via schools we can help. We've also got to remember that domestic abuse, as I'm sure that you're aware, isn't just about intimate partners. There is, of course, domestic abuse which occurs within homes of children attacking parents and parents attacking children, that too is domestic abuse and is just as worthy of being tackled and needs to be tackled in the same way. But I do agree with you that a programme within schools is going to be helpful. How we do it, you know, I'm not the expert on how we do it, but we do need to recognise it. And the other thing that picks up really is that this is a cross-agency approach. We can't just assume that the police will deal with domestic abuse, or the county council, or the district council, or health. It's all working together that we've got to do it. That's the only way. We've got to focus on the potential victims and the potential perpetrators, rather than looking at the agencies that provide it.
Thanks, David.
Thank you, Ron. Colette's next.
Thank you. Good morning, David. David, I was very interested in your comments about high harm crime and ASB, and I would very much like to explore that more, either through this panel or through some kind of seminars and so on. As you know, I've got a troublesome patch, let's put it that way, and I'm already looking at that and thinking about how to. However, my question was, congratulations on yet again producing a good positive report, enabled by the fact that we have a highly rated police force and dedicated officers. But there must be some areas that are of concern to you, and I wondered what your number one worry, if you like, about the Hertfordshire policing. What would it be?
You're right to ask the question, and I suppose that a person who does this role well will change their view as the evidence comes in. I am really worried about the criminal justice system, rather than specifically policing. I'm really worried at the fact that people are not getting justice quickly enough. I am immensely concerned that even though in Hertfordshire, compared to national indicators, those who bring accusations of rape to police are unlikely to get justice. You know, nationally, fewer than 1% of those people who claim to have been raped actually get a positive disposal in court, and that is something which the whole system must be concerned about. I'm really worried still about violence against women and girls. I'm also concerned about the public's view of police legitimacy, and I think that that must be an issue for every single police and crime commissioner and deputy mayor across the country. We do get impacted, frankly, in terms of local opinion by what's happening nationally and specifically in the Met. And you know, it is difficult if there are communities who do not feel that the police engage with them fairly, and it is difficult if the police do not seem to be beyond any accusation of justice. So you know, that is something that we've got to keep working on. We've got to keep making sure that where there are problem police officers, that they leave the service, and that people recognise through me, through my holding of account, that we have a fine police force and that the people working in it are excellent, which they are, but we've still got to make sure we keep redoubling those efforts.
Thank you for that. I think it's quite interesting that, and I guess it's a reflection of the high quality of the policing that we have, that in many ways you're able to focus on areas where you can have influence, but not direct influence. So, for example, like you say, the criminal justice system. Whereas if you were weighed down with the actuality of policing, you wouldn't be able to have thoughts about this and share them, and hopefully do something about it. So thank you.
Thanks.
Thank you for that, Colette. Sunny?
Hello, good morning. I think there's a bit of interference. I don't know if
Yeah,
that's from me.
phone too near that's better. Sunny.
Okay. Hi, good morning. Thank you, David. Actually, quite a good read. People can't be surprised. I don't know, I often do a lot of skim reading, but it's actually very well presented. I just had 2 points, one rather minor and one more for a discussion. The more discussion point is my mother-in-law is a magistrate, not in Hertfordshire, but elsewhere. And a lot of talk of struggling to get magistrates through in terms of training. Lots of people have dropped out due to COVID, and obviously a lot of places have had to sort of go part-time, and this has the added on effect of cases not being coming through, and we know this on a national scale. In terms of Hertfordshire, are we better placed or similar problems exist?
I have to say that I am not linked closely to what's happening in magistrates, so I can't give you the exact answer on that. However, what I know, because clearly I have interactions, is that we across the country we struggle. We're down significantly in terms of numbers across the country, and Hertfordshire is no different to that. In fact, my chief exec, he'll know that I'm about to ask him, because my chief exec used to be the chief exec of the Magistrates Association, so he might have a specific answer for you on that. And whilst he's gathering his time and thanking me for that hospital pass, you can ask me the minor question you're going to do. So there are 2 points.
Very minor. Page 54, on the right-hand column at the top, there's some numbers missing. I don't know whether it's my copy, because I received it a bit earlier, with regards to the funding, how much to be allocated to victim services and how much for child sexual abuse. And
we highlighted that's, you know, in maps, when you have maps, there's an when you look at the A to Z, there are sometimes in the A to Z what are called checkpoints to make sure that other people don't copy it without doing that. And that was our checkpoint. We highlighted it in yellow to make sure that everyone would read to page 54. Thanks very much for raising it, and I'll make sure that when published that we'll have that in there. I think it's because we still haven't finalised the figures on that. That's why it's in there like that. But I hadn't noticed it, so or I hadn't remembered it from I last read it through. So thank you for that, Sunny. And again, Chris will probably notice that. Chris, have you got a view on the number of magistrates in Hertfordshire?
I put my hand up so that you could know that I'm happy to to talk about it. There are national recruitment issues with magistrates, and that has been exacerbated by COVID. You know, people who have been furloughed, you know, to engage with your employer after that has just happened. It's a difficult conversation to ask for additional time off to undertake public service duties. Part of the response to that has been to raise the retirement age of magistrates from 70 to 75 recently, and recently retired magistrates are being invited to come back to the bench, who, you know, 71, 72 years old, so they don't need retraining. Clearly that is an interim solution. That's not a long-term solution to the lack of particularly younger magistrates. The Magistrates Association is in the process of putting in place a number of different support networks for younger magistrates, from LGBTQ plus magistrates, Black, Asian, minority ethnic magistrates all now have specific support groups to address some particular issues that they might face in performing their duties, and particularly that engagement with employers. In Hertfordshire, the backlog of cases in magistrates' courts is actually reducing at the moment. Crown Court backlog is still increasing. So they are dealing with the lack of magistrates. A bench of 2 is often sitting instead of a bench of 3 to ensure that that backlog continues to be reduced. But there is a national issue with recruitment. That's very clear.
But I mean, I don't think age should necessarily get in the way. If the people want to serve and they're over 70, that's fine. I mean, the new chair of Ofcom is 79, Lord Grade. I mean, he's 79. Obviously, I would assume that just as the younger people get trained up, that the older members of the bench perhaps get trained in some of the newer sorts of matters around technology and that kind of criminal behaviour that they might not necessarily, on WhatsApp and sort of abuse that way. So I'm sure it's all about training as much as anything else. Why not? Got
yeah, and part of the impact actually of the retirement age being raised is it addresses the lack of trained bench chairs, which clearly when there's a high attrition rate and people have less service, then you have to have 5 years service before you can train as a bench chair. So that is being addressed through that raising of the retirement age.
Good, excellent. Thank you, Chris, for that. I've got Fiona, then John Hale. Fiona Hill.
Thank you. Morning, David. In my division at the moment, there's been a huge increase in metal theft, such as catalytic converters, due to the rise of the price of metals. And I just wondered if there's any cross-border working on this, because at the very least, it's extremely inconvenient and costly for residents, and at the most, very distressing for the victims. So just wondered if we are doing anything to try and resolve this in some way.
I mean, we work very closely with Eastern Region forces, and specifically with Bedfordshire and Cambridgeshire. In fact, our major crime unit is a Bedfordshire, Cambridgeshire, Hertfordshire major crime unit. And if they are doing this through organised crime groups, which they may well be, that would be the focus of the major crime unit, or indeed the East of England unit. So the answer is yes, but clearly one of the real positive things about the way that we plan is that doesn't mean to say that we don't have local policing based within each district and borough. Our command structure is based across the districts and boroughs of Hertfordshire, so you get the best of both worlds. So yes, we do work cross border, but you will still have a North Herts police team which is working closely, hopefully with you.
Thank you, Dave. Thank you, Fiona. John Hale.
Thank you, Maurice. David, a couple of points on the report. On page 24 of the report, when you're talking about youth offending, you have a sentence that says, I recognise that we have a higher rate of first-time entrants than other similar police forces, and I want to ensure that we're considering community resolution. Can you explain a little bit more what you mean by a first-time entrant? I wasn't familiar with the phrase.
Yes, it means what it says. People just entering in rather than those who've been into the system for some while. So those are people who would be particularly well suited to the sorts of interventions that both the youth offending team and more widely the out of court disposals may well work with. I'm not someone who wants. I'm reflecting, I think, what the public want, which is they don't want people to be criminalised. They want people to stop offending, and so a particularly good group of people for that are those who are just on the verge of offending or have actually just tipped over, and we need to be thinking about how we can keep them out of the criminal justice system with support, and while still recognizing that there will be a victim of the crime that they have committed, and ensuring that the victim of that crime also is content with that as an approach. But one of the concerns I've got is that if we don't win the philosophical argument about why out of court disposal makes so much sense, there is a danger that it is seen as a resource cutting approach, where in fact it can be a more expensive way of doing things, but it is seen as, well, you've got a very long queue into court, you've got not enough money to be able to do this or that, and therefore we will do an out of court disposal. That isn't why it's there. It's one of the problems with of trying to get this new approach in, or perhaps not new approach, but this different approach in, is that people will think it's something to do with resources, which it isn't.
So at what stage are we identifying these as first-time entrants? Because everybody has their first criminal offence. Well, not everybody, but people who enter the criminal system will have their first offence. And if we're doing a really good job of stopping repeat offenders, then we would expect to have a very high percentage of first-time offenders. Yeah. But at what stage are you defining somebody as a first-time entrant?
I'm not sure that I'm quite as formally as you're tugging it to sort of say, right, you know, what are the very edges of it, and I'm not sure that I have gone quite as far as to say this is exactly chapter and verse. There will be other people who have, but my mind hasn't yet got to that. But a first time, I'm using a first time offender as someone who has been, the first time they have been caught is what I am using as a first time offender.
Okay, right. And then the second thing I just wanted to ask about was on road traffic policing. Pleased to see that you're continuing with your various initiatives as PCC. Very little in the report about what the police are actually doing. And we still have, in my opinion, an unacceptably high level of deaths as a result of road traffic collisions in the county. Are you satisfied that the Chief Constable and the other ones, because I think it's again a joint operation with Bedfordshire and Cambridgeshire, are doing enough about road traffic policing, and are the courts doing enough about the offenders that they catch?
Yeah, I mean, so let's talk about what's within my influence and purview, and what is specifically what I can do. So clearly, there are sort of 3 or 4 different directions which come out of a very simple question, as is often the case. First of all, I tend not to comment on what happens in court. Court is independent. They've got to make their own decision based on the evidence they see before them. I've no reason to believe that they're not basing their decisions on the evidence in front of them. So I find it's often unhelpful to comment on sentences given or outcomes, although actually you've rubbed up against something which I would like to have greater influence on, which is the whole criminal justice system, where we can look at the evidence of what has happened on a sort of blind basis of just taking, you know, everything that's been through court and actually seeing where we're at. And I think it would be really interesting to do that around various offences. There are clearly more people who commit driving offences than are actually brought to justice. Clearly that happens, and we need to think about how we get that culture change, because the best way of not getting an offence, as I say, is for it not happening in the first place, and that actually is around changing culture. That's around getting people to think, as I think broadly we have around drink driving, but less so perhaps around speeding so far, but actually getting people to believe that what they're doing is dangerous and inappropriate, rather than feeling that, you know, they've been harm done to if they've been caught. I'm also clearly, and that's not part of the question, although you alluded to it, I think that some of the things like bringing in the sort of the extra police, the police and crime commissioner speeding vans, which don't necessarily slap a conviction against you, but do remind you of what you were doing, can be part of that change of culture, and that's really what this is about. And I suppose finally we have got the police at a previous police and crime panel. I was able to respond to a campaigner for 20's Plenty who wanted to know, do the police enforce or will the police enforce speed limits? And I think it's quite clear that the police will enforce all speed limits, whether they're 20 miles an hour or 70 miles an hour. The roads policing unit is in some ways a distraction in terms of what that's about, because the roads policing unit is not based really around trying to enforce 20-mile-an-hour speed limits. There is a threat, harm and risk assessment which is done, which leads the police to enforce on those places where the greatest harm is done. So that tends to be, although not exclusively, but you tend to see roads policing patrols on the motorways and major A roads rather than on side roads or whatever. So you need a different way of enforcing that, and I'm content, because you asked whether or not I am content. I'm content that the police do that, but I recognise we need to keep building on it and we need to keep changing culture.
Thank you, David.
Thank you very much indeed. And thank you, John. Some great questions. We've had over half an hour now on this. So, David, thank you very much indeed. Once again, we do appreciate your attendance at these panel meetings, and Chris also too. And we look forward to seeing you again soon. So, David, thank you very much indeed for joining us.
Thanks very much, Maurice.
This morning.
Take care. Cheerio.
Thank you. Colleagues, we're asked to note the content of the report. So are we happy to agree to note it? So we either agree or disagree or abstain. So if you could just put that in the or for noting, whichever way. I'm not sure what's the best English, but whatever it is, if you could put it in now, that would be helpful in the chat. Let's wait for Carly to send me a magic message. Thank you very much indeed. So that item has been agreed. Moving over now to item 4, the Police and Crime Panel update from the Council's representative. So that's our Vice Chair, Fiona Thompson, who's the Hertfordshire County Council representative on the Police and Crime Panel. There were no recommendations. It's a verbal update on the business of the PCP. Fiona.
Thank you very much, Maurice. And since this panel last met at the beginning of February, the Police and Crime Panel has met twice. And at the meeting on the 8th of February, the Police and Crime Commissioner introduced his precept report, and that's the proposed policing precept of council tax for the year 22-23, and that was agreed. And then at the meeting on the 17th of March, the Police and Crime Commissioner introduced his police and crime plan, which David has just spoken about. And you'll have noted 148 actions, and I think of particular note to the panel is actually how do we monitor the actions. So moving forward, we'll be interested in seeing the annual report. We agreed with the 6 priorities, which David has outlined earlier this morning, and obviously the annual delivery plan reporting of outcomes will be critical as the Police and Crime Panel achieves its objectives really of supporting and scrutinising the Commissioner. Just of note, at the last Public Health and Community Safety Panel, member had asked about future meetings of the Police and Crime Panel to be put on the website, and hopefully that you'll notice that is the case now. And the minutes are included on the Police and Crime Panel website. And just to add, summary of questions and answers from the meeting on the 8th of February has been included at Appendix 3 of the minutes for people to read. And the next meeting is on the 23rd of June at East Herts Council. And as always, if members of the public wish to submit a question, they are encouraged to do so. Happy to take any questions. I'm always conscious, because we are so lucky to have David coming to this meeting. He tends to cover a lot of what's discussed at the Police and Crime Panel.
Yeah, we had this discussion the other day, myself and yourself, as to the benefit of this, but I do think it's still beneficial, just to hear it from an elected member's point of view, and also on the occasions when David may not be here, even more so. So I think we keep it as a standing item. As I said, there are no recommendations. I don't intend to hang around long on it because, as you say, we've had a chance to cross-examine the police commissioner this morning. But I'm grateful for that update. So I don't see any hands, and there's no recommendations as such. So if I can thank you for that, Fiona, that's very helpful. We move over now to item 5 on the agenda, the COVID-19 Vulnerable People Strategy, and this is with Jim McManus, our Executive Director of Public Health. Over to you, Jim.
Sharon, thank you. Apologies for the quality of lighting. I'm in County Hall, but something seems to have gone slightly amiss in my office.
Why are you in the broom cupboard? I don't understand.
Well, it's probably, I'm not quite sure. I think they probably put me in here so I'd be less disruptive, Chairman.
Fair enough. I can understand. Okay, over to you, Jim.
You can't blame them, really. So you'll have a paper in your papers, item 5, which is about Vulnerable People's Plan. The background for this is quite important because depending on how you calculate risk, there are anything up to 64,000 people in the county who remain at increased risk of severe disease should they get COVID-19. There's quite a range of estimates, so we're going with what is probably the third from highest estimate, if you like. And that requires a multi-agency strategy to both protect and support them. As we move out of COVID safeguards for most people, we still have something to do with that population, which is to ensure, if we can, we protect them from infection, but also to get ready for the consequences of infection. And it's probably fair to say that it has been a bit piecemeal in coming together nationally, partly because we know some people who are more at risk, but we don't know everyone who's at risk because of genetic and other factors. So because of that, and because of the fact that the strategy for COVID is vaccination plus, it's not only vaccines and let the virus go through, we felt it was important to try to draw together a fairly rapid strategy, and this is a start, not the end. So we got a group of agencies together. We actually sat down with some colleagues who were clinically extremely vulnerable and identified a series of priorities, and I'll just go quickly through them and then stop. The first is that we keep a very close eye on risk as it develops. So some people are at greater risk than others. If you are older and have diabetes, you are at more risk than if you're younger and healthy, but there are risks in that population. The second thing is that we get a register together of people so that if they need to get a priority access to testing or vaccination, they can be vaccinated. And as you've probably heard, the spring booster for people who are vulnerable is now beginning to be rolled out. The next action is about targeted communications about what they can do. There's a lot of people out there who are quite worried actually about what they can and can't do. And it's probably fair to say that there are some people who perhaps no longer need to shield, who are actually wondering about the information for them and what that means. That means that we have to work with businesses to say, look, if people are wearing face coverings or if people are vulnerable in your workplaces, you do have a duty still under the Health and Safety at Work Act to take appropriate measures for them. But equally, we all have a duty to kind of make sure that they can feel safe and do whatever they can. So I would highlight that this is not the Great Barrington Declaration focused protection approach. It absolutely isn't. It isn't a herd immunity of shield the vulnerable and let it rip through. This is a plan that actually seeks to do whatever we can in the current policy framework to enable people who are vulnerable to live as fully as they can and live without restrictions as much as possible. I won't go through all the actions, but what I will say is that we've already pulled together a group. The Vulnerable People's Cell, the VPAC cell, which you've probably heard of right through COVID, which is led by Christy Thacker and colleagues, is working on this and coordinating it. The plan was signed off by the Health Protection Board, and just in terms of some of the actions, so the booster's already started. Most people who are clinically extremely vulnerable should now have priority PCR tests in case they develop symptoms. They are already on a list to get priority access to antivirals and monoclonal antibodies in case they do become ill, because if they do become ill, we want to stop them becoming very seriously ill and ending up in hospital. So those planks are already underway to ensure that there are good pathways into treatment. The idea is that we try and protect people where we can. Where people do get infected, we identify it early and we get early treatment in place that stops them becoming very seriously ill. Now, that's a small number of people in the county, but it's an important number of people in the county, and this will prevent avoidable deaths if we get it right. So we wanted to get this in rather than get it perfect, so that we start the action and refine it as we go along. That means we need to spend more time talking with people who are vulnerable. I'll stop there, Chair, but that was a bit of a canter through where we are on that.
Thank you very much indeed for that. Ron Tyndall was first up for this. So, Ron?
Thank you very much, Maurice. Jim, thank you for that. I should add, National Service have already collared me and I go for my booster in the morning, so the system is working. On in the budget papers on page 119, there was a very convenient box which identified the key risks in achieving IP proposals, which would include, of course, vulnerable people. And the first and third bullet points attracted me. The government commitment has been given to maintain the public health grant in real terms, and additional demands on public health from ICS and service raised need and government, no mention in spending view of additional funding for them. So given the fact that it looks as if the public health grant is not inflation proofed, and we're running at 6 coming into 7%, and that also there doesn't seem to be an awful lot in the Chancellor's spring statement, are the risks greater that we are going to have a problem with funding the Vulnerable People's Programme and our other programmes generally going forward?
I think there's several things in there. So when the grant was announced, the increase was less than the prevailing rate of inflation, but also there were some new burdens added in. So this year we'll be mainstreaming pre-exposure prophylaxis for people with HIV, and we expect the cost of that to go up. There's also the fact that the NHS pay rise for our NHS staff, which we have no control over, but we do commission services from the NHS. So school nursing, health visiting, sexual health are all provided by the NHS for us under contract. We have to meet the burdens of that, which are greater than the overall uplift. Our financial plan suggests that we will be okay for this year, because in terms of the COVID demand, we have of course carried forward some of the Contain Outbreak Management Fund. We took the view in Hertfordshire that the Contain Outbreak Management Fund, we would seek to make it last, as it were, Ron, rather than spend it all. So we have carried forward an underspend for this financial year, specifically designed to help us meet COVID for this year. And the Health Protection Board has agreed 4 priorities, or one of which obviously is protecting vulnerable people. So in terms of the Vulnerable People's Plan for this year, I think our funding should be sufficient. Sorry, that was a bit of a nuanced answer with multiple things in it. So there's multiple strands to it, but I think the short measure is we should be okay this year.
Thanks very much, Jim. Maurice, I don't know if I could ask if the present financial situation continues, perhaps an item at the next meeting on how the growing inflation will affect our whole public health programme might be good.
Yes, I mean, I think that's not unreasonable as we keep an eye on costs throughout the year. I think we don't need a standing item. An update every so often about how it might be affecting us is worthwhile. If it won't be the next one, it'll be the one after. It depends how long it takes for some of these things to click in. And of course, yes, that's a good idea. Thanks, Ron. Jim, when I say that I'm going to give a nuanced response, people say you're not answering the question because that's what I understand. That's what I understand nuance to me. No, I shouldn't say such things. Sonny, next.
Thank you, Chair. Thank you, Jim. Really quick question. The panoramic trial, which is mentioned in your report, I was of the understanding that was not necessarily for those that are clinically vulnerable. Has it been extended to include that group now?
They seem to be recruiting some people who are clinically vulnerable, but one of the things in terms of practice is it seems to be useful to get as many people into that trial anyway, so that we can identify the results of it. But the latest information I had from some of the clinicians as colleagues were that they were including people who were clinically vulnerable. That's what I've been told, but I'll go back and double check that.
Thank you, Jim.
Thanks, Sonny. Fiona Thompson.
Yeah, thanks very much. Thank you for this, Jim. Just thinking ahead to 1st of April and the changes to testing, I know there are many family members of those who are clinically extremely vulnerable, especially those in care homes who are concerned about how this may impact them. I just wondered, can you just talk a bit about the plans for care homes moving forward as part of protecting the clinically extremely vulnerable and the support we're giving to them across Hertfordshire?
Yeah, so we're waiting for officials to send us the testing plan beyond the 1st of April. What we know is that there will still be a testing regime for staff in care homes and for visitors in care homes and for staff in social care. We also know that we're going to do whatever we can to open visits up more safely to people in care homes as part of that progressive work, because if you're a negative visitor going into a care home and are double vaccinated and boosted, the risk of you taking COVID in is really quite minimal, because actually Omicron is probably already circulating in the care homes because it's impossible to keep it out. What we don't know is whether that will be enough to meet the AXA guidelines in terms of the government's plan. So we have set up our own testing working group to look at what testing is needed for vulnerable people and for particularly high-risk situations like care homes to come up with recommendations, which is one of the things we did to look forward to that. So there will be a testing offer. The issue will be when we get the national framework and how quickly we can commission that and what government will commission. And I expect that it will be a bit of us commissioning it and a bit of government commissioning it to meet the national framework, which is why we deliberately held back some of the finances, obviously because we didn't know what COVID was going to do this year.
Okay, so there will be support moving forward. I think that's really critical. I know my experience of visiting a relative in the care home throughout last year, I have to say the care home was very well equipped and made sure that every effort was taken to ensure utmost safety of everybody, which was really, really important, but yet facilitate visiting, which again is so important. And I would hate if there was something that prevented visitors from being able to access their loved ones. I think that would be really detrimental for everybody's health and well-being. So I'm really reassured by that. And I suppose we just need to wait to see what comes forward. Okay, thank you. Thank you, Chair.
Thank you. Colleagues, I'm aware that the next item is actually a COVID update report. So it's worth having them as separate items, but there may be people who want to make comments generally about COVID. I think this one was specifically to give us an update on the vulnerable people strategy. We've taken the comments from the update from Jim itself. So why don't we just, if we're happy to agree to note that, well, now that we've commented this report, so then we can get onto the COVID general update, because I think that there'll be more to discuss in that one as well, and some of it may dovetail. So let's record if we're happy to note. Just wait to get the thumbs up here. Thank you very much. That report has been noted. So we segue very nicely into the COVID-19 update report. And I must tell you, Jim, I probably know more people now with COVID than I did during the height of the pandemic, though thankfully I don't know anyone who's passed recently, which I did sadly during the pandemic. So it's obviously different, as we understand. So COVID update report, Jim, is with you now, and I can see that you're going to make a presentation on screen. That's good.
Oh, thank you, Chair. And presumably you can see the slides.
Yeah, I think, do they get any bigger? Is it maybe my screen because I've got chat on?
Let me check. Is that better?
Yeah, that's better. Yeah, that's the one.
Wonderful. That's what happens when you use two screens. I'm not that great with this laptop. So as you say, COVID Omicron seems to be everywhere. The numbers are going up. It is much more transmissible than Delta, and it's probably fair to say, and if you've lost a loved one, this isn't meant to be callous, but in terms of the population, we are lucky that the current variants are Omicron, not Delta, because the level of severity and deaths would be higher. So the numbers of dying are very small, ones and twos, but some people are still dying, but most people are getting it and recovering. So I think it was fortune, not design, that the current variant that's going around is Omicron. Moving on to just the key metrics, this graph shows you the kind of 8 key metrics that we look at. So as you can see, the case rate is going up, the top left-hand corner. The cases have more than trebled in the last 3 weeks. The interesting thing is that the case rate change, in other words, the speed at which the rate goes up or down, seems to have gone up very quickly and looks to be beginning to plateau or go down again. That's a good thing, because it may mean that the surge will start to flatten. It will still keep going up for a couple of weeks, but it may mean that it starts to flatten in the next 2 to 3 weeks and go down. My understanding of the reason for that is because people have changed their behaviours, but also the virus is, in a way, running out of some people to infect with this latest variant, and I'll come on to that. You can see, though, that the case rate overall in over 60s is still climbing, and the case rate overall is going. So the epidemic's still rising, but the speed is slowing, if you like. That's probably where we are. Care home cases are back up again, but they're much lower than they were before Christmas. So they're around the 150 mark, which is about a half to a third of where they were a few months ago. The number of people in hospital in rehab beds is still hovering around 150. The hospital admissions have gone back up, so we have over 100 people in hospital, but the mechanical ventilation bed use is still below 5, which actually is great. That's really good news. And the death rate has thankfully slowed, but has gone up a little. So we are seeing 1s and 2s die in a week rather than 20s and 30s, which we were seeing in the first peak. Still tragic, but less awful for the population, although tragic for people who lose people. Staff absence in acute hospitals is back up again. It's over 200 because this virus variant is very transmissible. You can see also that, that a sign that we're in full epidemic mode is the fact that the positivity, the top graph, has gone back up again to around 23%, having dropped, having soared to over 30%. So around 1 in 4 people who test are testing positive. And although the testing rate has dropped since January, because it was the highest it has ever been, the testing rate is around about where it was this time last summer, at about 2,000 to 2,200 people per 100,000. So testing has not dropped off the face of the earth, as some people have said. It's gone back to a baseline, and that baseline seems to be continuing. If you look at our case rate, you can see the major peak of cases that we had in December, January. Then we had another hump and it's dropped, and it has gone back up again. All of that is Omicron, and you can see that sharp rise, which is very characteristic of the Omicron's variant's transmissibility. Emergency department attendances have also gone up. So this figure is Hertfordshire, and you can see that the solid line is, oh sorry, this is the East of England figure, which is better than the Hertfordshire one, because it's less busy. The solid line is numbers for emergency attendances going up on any one day for respiratory disease, and that's a good sentinel, because although it measures any kind of respiratory disease, a lot of that will be COVID. And you can see the dotted line, the baseline of where we were a year ago, was actually going down at the minute because we're leaving the flu season. You can see that solid line is going up, which means that emergency attendances are actually rising, which is a good sign that we're in epidemic mode. If you look at intensive care admissions, the solid blue, mid blue line is the one to look at, the one that says 0.7. Emergency admissions to intensive care units have gone up to around 0.7 per 100,000 population, but they, having dropped, you can see at week 52, hovered and then have gone back up again and are plateauing. So the numbers are still much lower in intensive care units than they were when, if you look at the dotted lines, during the 2020 and 21 years of the pandemic. So it's qualified good news. This is a good graph to look at because it takes Hertfordshire and looks at vomiting, and the baseline is where we would be in the last 2 years without COVID. The purple line is where we are now, and you can see actually that the number of cases of people reporting vomiting has gone up, and that is a symptom that some people are reporting with that, and those are calls to NHS 111. So all of these signs are saying that this is burgeoning and going nowhere in the near future. Why? Well, we're having a fight between two different variants. Omicron is actually a family of variants, and the two principal ones that are around are BA1, which is the green box there that was around before Christmas and was what caused the major surge just before Christmas. The yellow is BA2. So in essence, you've got two epidemics going on, one of BA1 and one of BA2. They're both having a fight for dominance. You can see that BA1 is still currently fighting its own, but BA2 will probably take over from that. And we're seeing about 10% reinfections, so people will get BA1 and about 10% of them will get BA2 a few weeks afterwards. And we think that reinfections are occurring from the surveillance we have at about that rate. So it's not uncommon to see people getting reinfected actually twice, and in some cases up to 3 times, particularly children, with significant disruption that causes. So we're going to have to weather this for at least the next few weeks. Some good news is that if you look at our vaccine uptake, and I'm sorry that this is an NHS graph and I couldn't make it any better, but the key figure to look at is the age 50 plus, and it shows across East and North Herts in blue and Herts Valley in orange, West Essex in grey, the coverage of 2 doses plus the booster. And actually for everyone over age 50, we're talking 90% coverage. That's really, really good, because most people admitted to intensive care or into hospitals are unvaccinated or not fully vaccinated. So the vaccine is working, the vaccine is doing its job. We still have quite a lot of work to do to get some of the younger populations vaccinated. So you can see in the 30 age group that the booster rate is about 77%. We want that higher, but we are seeing the benefit of vaccines. And there is no doubt that had we not had as many people vaccinated, we'd have many more people in hospital and many more people seriously ill, and we would have many more deaths. But the virus is still having a severe impact. Now, cumulatively, we think the numbers tell us that we have had 365,500 cases cumulatively in Hertfordshire since the start of the pandemic, and our first case was in February 2020. You could see that as being the fact that the virus still has 700,000 people it can infect. That's probably an underestimate in terms of the number of cases. It may be more like 450,000 depending on national statistics. But you can see that this virus has not run out of places to go yet, which is why vaccination is so important. Sadly, 2,931 people have lost their lives, according to the Office for National Statistics. So the virus hasn't done with us yet. We have 150 outbreaks in schools currently. That's up from 111 3 weeks ago. Our employers are reporting sickness absence up, NHS sickness absence is up, and it's still working through. So we are in a very highly volatile situation. And if you look at this graph, this is from the Financial Times, and it compares New Zealand with Hong Kong. And if you look at New Zealand, where very few people are unvaccinated, only 2%, the blue line is cases and the red line is deaths. We want to be like New Zealand in terms of vaccination rates, where we have that very small number of deaths, and we're well on the way there, I have to say. If you look at Hong Kong, where actually 66% of over 80s are unvaccinated and they're currently going through a massive Omicron wave, you can see this huge red spike of deaths that we want to avoid. So thankfully, we are more like New Zealand and Hong Kong, but the idea that Omicron doesn't kill people is really true, largely due to vaccination and largely due to the fact that the vaccinations are working still to reduce severe disease. There are 4 big drivers of infection, I have to say. New variants is one of them, waning immunity is another. But currently the 2 biggest ones are indoor air quality being poor and reinfection, and also the behaviour of individuals and organisations. I've said before, zero COVID is practically impossible. You can't stop this virus getting into places. So we are in a strategy where we have to try to keep the spread low, and we have to try to keep disease and deaths and disruption low. And that brings us on to what is a vaccines plus strategy. It's not a vaccine only strategy, but the 5 planks of our actions, and I'm nearly finished, you'll be pleased to know, are firstly developing and maintaining high levels of immunity through vaccines. Immunity from infections does help, but we also need immunity from vaccines, because immunity from infection in and of itself is not enough and doesn't last as long as immunity from vaccination. We still do need risk mitigation for high-risk settings, so testing regimes for social care, for example. Infection control in the NHS is different if you go into hospital than it is in the community. We also need individuals still to be changing their behaviour, and one of the consistent things that has happened throughout the pandemic is residents in Hertfordshire have changed their behaviour. Massive changes in behaviour, which you can see by looking at Google Analytics for transport and also in terms of surveys. So that needs to continue, and we need to build on that. And then at the far right hand side, minimising the impact of the disease on people at very high risk. Our vulnerable people strategy is a plank on that. Making sure that people give up smoking if they smoke, because that is also a risk. And as we know, 4,000 people have given up smoking in Hertfordshire alone during the pandemic. And saving lives when people are hospitalised due to good care. So it remains not a vaccine-only strategy, it's a vaccine plus. We've undertaken a resident survey, so thanks to colleagues in communications for running this, with 3,700 Hertfordshire respondents. The main concerns were that people might not isolate when they have COVID. People are concerned about that. They're also concerned that we can't quite go back to normal while COVID is still here. And the majority of people said they would still stay at home if they get COVID, 72%. They would still wear a face covering in crowded places, even though that may have eased off about 68%. 50% are actually concerned about the impact of passing COVID on to a loved one. So the residents of Hertfordshire do want to be safe. They do want to be cautious. And many of them have talked about continuing behaviours that will work. So in light of that, our local action on the situation that we're in has 5 major planks. First of all, the Spring Booster is now being rolled out to people who are at much higher risk, so people over 75, residents of care homes and the immunocompromised. Secondly, we are continuing advice and support to schools, workplaces and businesses, because that's very important, particularly if they have vulnerable staff. Thirdly, a new campaign on safer behaviours for everyone will be launched soon, and a targeted campaign for people who are vulnerable will also be launched. And then we have the Vulnerable People's Plan. So, Chairman, I'll stop there if I may. Very happy to take any questions. And obviously a copy of these slides will be made available to members and put on the website.
Thank you very much indeed for that. Jim, I'm going to take feedback, so all ads better. Sunny, over to you.
Thank you, Maurice. Thanks, Jim. Quick question. Do we have any dates for the 4th booster, as they call it, for those who are not clinically vulnerable? So going back to the age stratification like we had previously.
Very good question. Not yet. And I think the reasoning behind that for the UK Joint Committee on Vaccination and Immunisation is they're waiting to see what the impact of the next variant might be, and the Omicron variant. Currently, the vaccines still work really well against BA2. In fact, they're slightly better against BA2 than BA1. And by work, we mean prevent severe disease, although they do reduce infection, but they don't stop infection. So it's a watch this space, I'm afraid.
And one last one.
Yeah.
I got COVID before Christmas, and that was almost certainly one version of the Omicron. Is the one that's going through now a different version of Omicron, or is it because we're socializing more than we had previously?
It seems to be a mixture of things. So undoubtedly people are socializing more. So Omicron BA1 is merrily spreading. But also, as you say, Omicron BA2, another subvariant, is also merrily spreading, and the two are having a fight. And if you add to that the fact that it is much more transmissible than Delta, you have the virus will do what viruses do, which is merrily have a field day and spread. And we are very fortunate, I think, that these two variants are, for most people, milder than Delta. So it's all of the above.
Thank you, Jim.
Thanks, Sunny. Fiona Thompson.
Yeah, thank you, Maurice. Thank you, Jim, for this. Really interesting to see how the variant is shifting, and especially in terms of symptoms. And something you mentioned about vomiting, and there's been an increase in vomiting. That wasn't one I'd been aware of. Now, I was out and about at the weekend and went for dinner. You know, there was such a range in people's behaviours, from some people fully masked up, but the majority perhaps weren't. And obviously people have relaxed a lot. And I know it's very hard to get the message out because ostensibly perhaps people who we need to get the message out to maybe are the ones who've already changed their behaviours, or maybe won't take enhanced behaviours. But I just wonder how we can do more to get, you know, those key messages out about, you know, there is still a risk, and clearly we need to take precautions where possible, and especially in terms of vomiting, recognising that as a symptom. I've also heard, you know, people with, not to do with me, but ear problems separately post, you know, from COVID, and it seems to be changing. I just wonder what more can we do to encourage people to adopt behaviours that are needed?
I think we've got quite a complicated situation going on in terms of the microbiology of Hertfordshire, if I might put it like that, because you've got a whole load of stuff that was pretty much nowhere. So most respiratory viruses, RSV in children, flu-like illnesses, that are all having a bit of a field day at the minute because people are circulating. You've got norovirus has gone back up, partly because there has been some behaviour in people washing their hands, and a lot of people using sanitizer and not washing their hands. And then you have COVID creating a bit of a field day. You also have the real confusion of the symptoms, because people will have what feels like flu, test negative for COVID for several days. But actually, one of the reasons they're not testing is because your immune system mounts a very strong symptom response to Omicron, even with very small levels of viral load in your body sometimes. So you may not be testing positive, but you do actually have COVID. So there's a lot of people who've got COVID who think they've had something else. And when you do a test afterwards, lo and behold, you find for a PCR test that they've been infected. My pet hate is when you go into a building, such as a dentist or an optician's or you know, even a hotel or somewhere, and they make you take a fresh sanitized pen from a box and put it in the dirty pens, but the air is stuffy and there's no ventilation, and the virus is airborne. So actually they're mitigating against risks that are minor rather than serious risks. The good news is the residents of Hertfordshire actually do want to take the right behaviours. So a targeted campaign that's about ventilation and about airborne and the measures that you can take is and the fact that most people want to do them. So our residents have been pro-social. That's going to be the focus of the campaign that's launching, because when we've done that before, it's worked. Have I answered your question?
Yes, thank you. And just a quick follow-up, if I may, Maurice. Do you think the Easter holidays will give us a bit of a circuit break, if you like, in terms of spread, or is it likely to add to it?
I think it's quite interesting in that the space of about 10 days, people have already started to change their behaviour from the measures that I can see. So hence the kind of the rate change graph that we saw earlier. If that continues and we go into the Easter holidays with people doing that, we will avoid much more disruption and possibly avoid a peak. So this time last week I was saying we might get a peak around Easter, but it looks like people have already started their behaviour. So the peak might be lower than it would otherwise be without that. So I think the Easter holidays might give us a break, because of course the schools outbreaks are growing and more school staff are off sick as well. So we could in the next 2 weeks go from a really bad peak at Easter to a peak that's much lower, because actually people's behaviour has started changing. That's a really good thing.
Yeah. Okay. Thank you for that, Jim. Thank you, Maurice.
Thank you very much indeed. John Hale.
Thank you, Maurice. Jim, you just mentioned it again in your answer to Fiona about the positivity rate and being higher now. Obviously, the positivity rate is partly driven by how many people in the population have got COVID and how many people and what group of those people are actually testing. And I think, back in last year when schools were being told they had to take 2 tests a week, you had a lot of people like my wife very diligently testing when they didn't think they had COVID. They had no reason to believe they had COVID and they had negative results. She's no longer testing, so she's dropped out. And, if the rate had stayed the same, that sort of change would increase the positivity. You did say that the number of people testing was similar to back last summer. And what I was wondering was, have we got a similar level of positivity to last summer, or is it higher or lower?
So the first thing is to bear in mind these are PCR tests where people have symptoms, not LFT tests. The level of positivity was last time I looked is highest in younger people. So we're talking about 28%. Sorry, we're talking about 28% in our younger population, and it goes down to about 11% in our 80 population. So there's a definite age gradient in positivity. And if you look back to last summer, so our positivity at the minute, I said, was around 23%. If you look at March 2021, the positivity rate was 2.6%. So it's 6 times higher, easily. 10 times higher almost than it was this time last year. And in fact, the positivity rate currently is higher than the peak in January 2021. So it's not as high as the Christmas peak at Christmas 2021, but that was 31%. We're only, 7-8% off the highest positivity we've ever had. And if you triangulate that with wastewater analysis, actually the viral positivity, the viral spread seems to be going up, not down.
Right. Yeah, the wastewater analysis I find very interesting, because I think it's less impacted by residents' behaviour.
Yes, and I mean I'm sure the chairman will tell you he regularly hears me talking bilge, but the wastewater analysis is a really good, consistent analysis, and all of the sites in Hertfordshire where we do wastewater are all showing the same pattern.
Thanks, Jim.
Thank you, John, and I'm grateful that I've still not been invited to a site visit for that. So long may that continue. A bit squeamish about these things, but it's interesting that we do get a whole host of information coming from so many different sources, and as I say, each plays its part. Jim, look, that's very interesting. As I've said, I think the COVID story is far but over, even though you hardly hear it spoken about at the moment. I hope it doesn't take a major situation like they appear to have in Shanghai at the moment to get it back up the agenda in people's minds. I know that they've ordered a lockdown in Shanghai again, so we'll wait and see. Colleagues, thank you very much indeed for your input into that particular item and to Jim's report. Jim, thank you very much. We're now asked, now that we've commented, to note it. Can I ask if everyone is happy to note the report using the chat button, please? Thank you very much indeed. That matter has been agreed, noted and agreed. So we come now to the final item on today's agenda, which is the Integrated Risk Management Plan Progress Report. And it's going to be presented by Andy Hopcraft, our Assistant Chief Fire Officer. I know I can see Andy there. I can see Alex, the boss man there, getting ready just in case, Andy. So over to you, but he'll be watching.
Thank you very much, Chair. Good morning, councillors and colleagues. Yes, I'm here this morning to provide an end-of-year progress overview of the Integrated Risk Management Plan. So this report sets out the progress made since last reporting to panel, which was June 2021. Essentially, we've broken down the delivery of the RMP proposals, which there are 7, into 3 phases. Phase 1 is now complete, and we're now well into delivery of phase 2, with the most significant progress being the completion of the services fire cover review, which is a very detailed piece of analysis looking at a comprehensive assessment and review of the current and future risks within Hertfordshire. It's worth noting that the fire cover review confirms the strengths of our current arrangements and also makes a number of recommendations where we've identified further possible improvements and opportunities to build on those strengths. The on-call review is now coming into business as usual, now that we've introduced a suite of initiatives which we think will deliver long-term benefit for all our on-call staff and increase the numbers and use of an important pillar of our operational response model. Previous reports had flagged up the delay in introducing our vehicle trials. Unfortunately, these delays have continued, primarily because of the impact of COVID in hampering the build time around these bespoke vehicles. But adding to our frustrations, there's been further delays due to faults identified with the rapid response vehicle. But I'm pleased to report that those have now been addressed and the vehicle is within service. We now look forward to moving on to the next phase of the RMP and implementing the remainder of the proposals, having already done a considerable work to prepare the ground for these prior. Changes in ridership on our whole-time fire engine will begin shortly, but this will be done on a considered and measured basis, enabling us to create a more flexible workforce, which we believe will increase appliance availability and better align resource to risk. So really affirming that that's about reallocating resource, not reducing resource. And thank you, Chair. That's my report, and I'm updated on my report.
Thank you, Andy. And okay, Alex, is there anything you want to add?
No, I think, Chairman, as we said, we wanted to give an overview of where we're at. I think Andy's taken us through the headline programme areas. From my perspective, I'm confident in the direction of travel and where we're going. Andy's touched on a couple of those points of delay that I think we understand operationally why they've happened. But apart from that, I think we've got a genuine positive direction now. Copies of the fire cover review have been circulated, and then we move into planning when HMI leaves us, which are due to finish by the end of this week. Morris, hopefully you're going to flag that up for me so that you've got that one by your bedside.
Every you mention fire cover review, wherever I am in the house, I have my copy. Just so happens that today I happen to be in the office, but downstairs. But yes, because anyone who thought I was surprised by Andy's short report, of course, we had a briefing before the weekend, so I knew. But yes, the fire cover review. Look, I'm not a great one for reading 135-page documents. Yes, well, John is, you see. I expect John to have that. But anyone who knows me, I normally go to the back of it's like the back of the book, conclusions. It's really, really interesting. And I would, even people just want to flick through it to see how people are performing our fire people in different areas, speeds of getting to incidents and so on. It's really, really interesting. And I do appreciate all the work that you guys have been doing. And I know that we get these big events happening every so often as well. And as I say, things tend to get a little bit overshadowed by other news, which is quite understandable. But I know there's all sorts of big events. We had one at Stevenage the other week as well. And Alex always keeps me up to date, even at weekends, if there's anything going on in the area. So I am grateful for the work you do. And joking apart, Andy, thank you for that presentation. Do we have any questions we have to ask? I'm not seeing any. I'm not seeing anyone's hands up. So I'm not going to encourage people, Andy, because that's a really good way. If you can get out without a question, you've played a blinder, mate. So, oh no. See, that's it. You tempted fate now. It's John Hale now. That's the end of it now, John.
Well, actually, Maurice, I just wanted to echo your comments about the quality of the file cover review. It was a very interesting thing I read, and as Alex said, and you know, because I've spoken to them about it, and also to say I'm pleased to see that the progress that's being made on implementing the actions. We obviously expected some delay because of what's been happening over the last 2 years, and I'm glad that those delays do not seem to be too bad. It's moving forward still. So thank you very much.
Thank you, Councillor.
There you go. Thanks for that, John. I appreciate that. Oh, now you see, this is it. You see, look, we're getting flooded by people now. Now we've got, hang on, I've got another hand gone up. Whose was that? No, it's gone down again. I think it was John taking his hand down. Colleagues, I think we can agree that this is it's good to have these updates at a panel, so we do get an opportunity to either question, to comment, or to thank, as well as we should always do our officers. I'm grateful. Thank you, Andy. I think therefore that what we have to do, just checking my notes, is that can we just now in the chat say if we're happy to note this report? Just checking. As I say, I'm working not off paper at all at the moment. Yes, we're asked to note. So here we go. People are rushing through. I think everyone wants a comfort break. Look at them coming through like over tomorrow now. Look at that. That's good. Just waiting for Carly to say that's been agreed. Yes, that's been agreed. So thank you, Andy, and thank you, Alex, for that. Much appreciated. And now we move over to item 8. Any other part 1 business, that's any other non-confidential business, of which there is none. There is no part 2 confidential business today, and therefore, before I close the meeting, I'll just say the date of the next meeting is the 19th of May at 10 a.m. Can I thank all officers for their presentations, all members for their attendance and their questions, and officers for their assistance from DEM services as well, member services. Thank you, everybody. Enjoy the rest of your day. Meeting closed. Thank you.